Welcome back. I'm Mabel, Jong, and you're watching continuing coverage of the World Healthcare Congress, coming to you live from Washington, D.C. And we have a variety of different panels happening today. One of them is Women in Leadership, and I'm so pleased to have with me right now a panelist, Dr. Mary Wilson, President and Executive Medical Director at the Southeast Permanente Medical Group. Welcome, Dr. Wilson.
Thank you.
Thank you so much for being here.
Yeah.
And so what are some of the things that you really want to highlight on the panel or leave with people here at the conference?
We're going to talk about what's the key ingredients, in a sense, of becoming a woman leader. What are the special challenges that women have in their journey from a young leader to an older leader? And what kinds of things do you need to emphasize? How do you overcome some of those challenges? And then how do you mentor and help other women to come up?
Okay. You know, I just had Dr. Redonda Miller here, who is with Johns Hopkins Hospital, and she was saying, should it be different for a woman than it is for a man? And she's constantly asked, is the agenda different? And she doesn't think so, but what do you think?
Well, you know, this is something I get commonly asked, and as someone who's in a certain age group that's older and has come up, when I was first thinking about it, I really thought, I don't remember that I admitted to myself or thought I was treated differently. Because I'm a physician, and for physicians, it's really about the quality that you deliver, and everybody can recognize it. But as I look back, there are ways that I think you do modify yourself as a woman that's not necessarily required of everyone, and it takes energy to do that, and some of that energy is expended in directions that aren't necessarily productive for you. There's also the challenge of, if you want to have a husband or a wife and have children, then that challenge has to be addressed. And that takes a certain amount of energy as well. So the challenge of family, the challenge of your own internalized worries and fears, I realized as I've gotten older that those things impact young women especially.
Are there different issues that are specific to the healthcare sector that may differ from what other businesses experience?
Yes, and I will preface that by saying I'm very lucky in who I chose to work for 30 years ago, which is Kaiser Permanente, because it's a very supportive environment. So it is important that you have an environment that supports women and that supports their leadership and that has diversity as its value, really. So that is very fortunate. But you have sort of leadership pathways that have to include different styles, that have to acknowledge diversity, that have to acknowledge that, and it's not just women, it's everybody who comes in with a different experience or a different look. And getting the value of that as a leader is tremendous, because you cannot get the best solutions without honoring that in the people around you, in your teams, and in yourself.
Okay. What are some of the professional barriers that you perhaps encountered when you first started out, and what is the advice you may give people who are starting out now?
Yeah, so everybody lives in their own skin and in their own body. So you face barriers based on people's conscious and unconscious biases. Everyone does. And so just self-awareness is probably the big thing you need to learn in your 20s and early 30s. What are you feeling? And how are you managing those feelings? What is the room feeling? What are other people feeling? And how are you going to impact that in the direction you want to go for the results you want? I have always tried not to dwell in a space of victimhood or defensiveness. I don't think you learn when you're in those spaces. So, you know, I try to think, well, what do I want out of this situation, and how do I adhere to my core values? And if you can be congruent in a moment, recognize yourself, and act on that, that's helpful. It's a tall order, because when you're younger, it's really hard. As you get older, I think it's a little easier, but you have to develop really good habits around it.
Young women are hearing some very powerful messages now that we may not have heard when we were coming up through the ranks. So, knowing that, what should employers remember when they are hiring women of today? They're much more educated and much more aware of their rights. And things that they want out of their work life.
That's right.
So,
and I think employers really, women will often have children. they'll often have that desire in their lives. That has to be acknowledged in the workplace in a powerful way. Women, life is long. Your kids are in your life for X amount of time. Women contribute before, during, and after they have kids, and there's evidence for that. So to pretend that that doesn't happen is not productive in the workplace.
Okay, so what do you see not happening that should happen then?
I think the colleagues, people have to support you in having your child and understanding what that looks like.
More
So do you
time
want
off,
or flexibility?
Okay.
So you asked earlier about medicine, how is that different? Patients deserve to be seen when they need to be seen, which means you can't just work 10 to 3 or when your kids are in school.
Okay.
You can't as a primary care doctor. You can't do that every day and have patients be able to see you. So there has to be flexibility on both sides, but flexible schedules really help everyone, not just women. So if you can work 4 days instead of 5, if you can stack your hours differently, if you can do a coverage so that someone else does weekends or nights, all of that stuff is really helpful to women.
Mm-hmm. And how are you?
And fair pay.
Fair pay.
Fair
okay.
pay. And one of the things that
Yes.
happens in medicine is your pay is associated with your specialty. So there is pretty much fair pay in that sense. But as you get into leadership roles, who gets chosen, that'll impact long-term income.
Is the trend towards certain specialties for women still sort of constant?
Oh, I'm not sure. I don't know,
Okay,
actually.
yes. And how are you celebrating the joy of your leadership role?
Oh, yeah. So I love that question, because when you're a frontline physician, like I was a pediatrician, you get your joy, a lot of it in the practice. In that one interaction is really fantastic. You give that up bit by bit as you go into leadership in medicine anyway. So in the end, you may just have 1 day a week when you're practicing. So the joy comes for me, like an example, say last week, one of my leaders who reports to me was just hit a home run at a meeting, did a really courageous thing around inpatient care and spoke honestly in her truth, and I think influenced care very favorably. And I think that gives me joy to see someone on my team hit a home run.
That's cool. That's great.
Yeah.
That's
and I
great.
think the other thing is it is lonely sometimes to be a leader if you're at the top of an organization. So having a peer group that you can relate to gives you a lot of joy as well.
And Dr. Wilson, you've made a move to another health market.
Yes.
How's that going?
Well, so as far as women in leadership goes, that's a question I get asked a lot, because I was in a very comfortable leadership position in Southern California and chose to do something that was 50% maybe out of my comfort zone, and just leapt into it. And part of that just came from my experience long term and an ability to take a risk maybe that I couldn't before, but just encouraging people to standing still seems safe, and it seldom is. Jumping forward is really often safer.
What is Kaiser's goal in the Southeast? What is your job there?
we are, I love Kaiser Permanente. We think we're the best thing that can happen to healthcare in America, and where we deliver care. So that's our belief. We have values and vision around that. So we want to grow and take care of more people in the Southeast and in Atlanta so that we can impact the health outcomes of the community. That's really why we're there.
Is it a very different market than in Southern California?
It is, although, again, I'm not an expert on this, but my observations from where I am is it's a less integrated market than it is in California, less HMO-based market.
Okay.
So more fee-for-service.
And how are you finding the conference so far?
I've loved it. I went this morning to the keynotes, and I thought it was really interesting. Very interesting. There was some topics from Hopkins that I thought were great, and then a panel of people around what do you do to transform care.
Yes, and is there a message that you want to leave with our viewers who aren't going to attend your session in person?
Oh yeah, what I'd love to say is, just as a woman, don't ever sell yourself short. Go for your dreams and your goals, and get help, talk to your friends, and don't be scared.
Right. Dr. Wilson, a real pleasure.
Thank you very much.
Thank you so much. And thank you for tuning in. Stay with us.